Hi, this is Cameo King, and welcome to another series, another segment in the Trusted Voices series. I am the host of the Good Girl Podcast, a podcast that comes on every week, and we're located here in the Lansing area. We focus on women's issues, we focus on uncomfortable truths, and I'm excited to lend my voice to the Trusted Voices series. This is a production of a relaunch Greater Lansing. Our goal is to communicate accurate, timely, and science-based information about COVID vaccines in hopes of encouraging everyone to receive the vaccine in the coming weeks. With us today is Randall Talifarro. He is the fire chief for the city of East Lansing. Chief Talifarro, thank you so much for chatting with us today.
Thank you for having me, Ms. King.
I'm excited for this conversation because I think the fire department, especially as a chief, you can possibly bring on a different perspective. Typically, when I think of COVID, I don't think of the fire department. So can you tell me what has been your approach, and also what is your role in terms of communicating with team members about COVID?
Okay. Our approach, and so my role has evolved. Originally, of course, there was very limited information coming out, and we were watching as some of our peers were dealing with cases throughout the nation and some of the challenges they were having. Of course, when they had the big nursing home incident in Washington, I think that is when it first became very evident that this could be and would likely be a problem that we would be confronted with. And so initially, our role was to we communicated by trying to get as much information as we could. And unfortunately, there was so much that was unknown originally that it made it difficult, but we have been very transparent about what we know, the things that we didn't understand or didn't know, and we just worked to really do some research, and we contacted some of those locations that had gone through some of the prior, the major incidents, so we could see what their experience was and kind of adapt our own behaviors based on those things.
And so when I think about everything that has been happening as it is connected to COVID, everything that is happening in terms of our communities, you all are oftentimes on the front line, and you and your team members have to answer the call for help at any time. And so when you insert a global pandemic, how has that shifted, the way you go about doing your job?
Well, that's, of course, been very challenging. We have had to protect not only our own staff, but we had to continue to be responsive to the community and for the community. And then we also had concerns about our staff's families and friends, because it's one of those viruses that could be transmitted, and it's very highly contagious. And so we had a number of concerns that made it extremely difficult. And I think it was frustrating for us how political it became, I think, and that, people lost sight of some of the challenges they were creating for us by being non-compliant or resistive, and that, again, those things would not just be restricted to us personally, but it would also potentially have some devastating effects on our own families. And so it was really difficult, and it still is, but we've gotten better about it. But it was, I can say, if you could imagine as a soldier, for example, and I know we're in the fire service, it's a little different, but when you sign up, you know that you might be putting yourself at risk, but you don't believe when you sign up for those responsibilities that you're putting perhaps your whole family at risk. And so that was sometimes a little demoralizing, or very, at least, I would say it gave us a lot to think about, and it made it very, very challenging.
Yeah, I can't even begin to fathom. And so when we're in the phase now where vaccines have become available, in a sense, for everyone, first responders. I know when I go in to include my interest in getting the vaccine, first responders are up there. What has the conversation been like between you and your team members, or even you and the public, when it comes to vaccines. And I say this because if one of your team members um, interacts with someone who potentially has COVID, then that could spread so easily because they're going to help other people and then thinking about their family. So what is the conversation like with first responders, with you all when it comes to the vaccine?
Well, I think that we perhaps are quicker to accept the real value of the vaccines and the potential for the vaccines. We have had people that have been very ill and some that are still recovering. And so we knew the devastating impacts. We also were treating patients and transporting patients and family members. And, we were visiting the hospital consistently and constantly. And so we saw the impact of this disease. And so recognizing that even in many cases where the disease wasn't fatal for someone, they still had some very challenging kind of outcomes. And so I'm not sure that many people understand that. They think it's like the flu. And for many people, it is just like the flu. But for those that it's not, they can have some major attacks on different systems of the body and have some long-term ongoing challenges with their health as a result of exposure to the virus.
What do you envision to be the biggest hurdle that you'll have to overcome regarding vaccines?
Well, again, I think this was so political at the beginning, and at the onset. And that was perhaps unexpected. We, as first responders, especially pre-hospital emergency medical services, and that's our relationship as fire. I don't know that I said that very clearly earlier, but, we, of course, have drilled and we have planned for mass distribution of medications. They had a plan that was called the National Pharmaceutical Stockpile Plan. And so we had I think, an impression of what was supposed to happen and what was going to happen, and none of that happened. And that was a little bit disorienting. And then to see that it became such a political issue as opposed to just a medical issue. And certainly we understand there was, the challenges very early for us. I mean, I'm in a university community. And so when you think about shutting down football and basketball and, large events, there's certainly an economic impact to restaurants and communities and businesses. And so you have to think about it not only from the financial and economic impact, which in and of itself is very distressing, but then you have to think about it as a public health side, and then you have to think about the politics of it. That was really something that I guess was unexpected to me.
Yeah. One of my last questions is kind of what's happening currently. So as of like this week, Michigan is like the superstar when it comes to COVID, carrying the banner of COVID. And obviously vaccines are out. But do you have any idea, based on what you've seen, based on, the conversations maybe you have with your team members or with the department, what is going to turn the tide? Are the vaccines going to be enough? Is it, I'm kind of asking you to predict the future.
Well, I can say that the information we've received is that the vaccines have been very helpful. And we have seen that also, it's been noticeable in our transporting of patients, and then also the severity of those patients that are getting the disease. We have, they've gotten better with the treatment modalities and protocols, so they're a little bit better there, but it's been pretty devastating. I think that one of the things that makes me think that the vaccines have been very effective is that we are now seeing different types of patients. So among the seniors and the high priority populations that receive the vaccines, the numbers have actually declined and decreased pretty significantly. And so that seems to suggest the vaccines are effective. And now it's just a matter of getting them out to other categories of people, whether we're seeing a lot more young people now that are the patients as opposed to those that were older and more vulnerable. And so I think that the vaccines are the answers, at least initially. I think treatment modality, and as they learn more about the virus itself, I liken it to HIV when it first arrived on the scene. And I remember as a young paramedic, many of the fears, many of the concerns, and then gradually the treatment got much better, and it was no longer necessarily, say, a death sentence for people. And I think, we'll see better medications for treating it, but I do think the vaccines are a very, very critical and vitally important first step.
Yeah, well, thank you so much, Chief Talifarro. I think, your insight and your background and what you've seen really allows us to see it in a different light. And as we're hopefully turning the tide, as more people get vaccines, and hopefully as more medical professionals and researchers are doing the work, we'll eventually see this level out, if not go away. So I definitely appreciate your time.
Thank you for having me, first of all, and I'm honored to be considered a trusted voice. I really thank you for having me. And, I would like to share one other misnomer. I'm sorry I meant to mention it earlier, but I think that what I would also like to say to the community, the broader community, is that some of the misinformation or misunderstood information, at least, is you hear people talk about having comorbidities or pre-existing illness, and that was something that might be a contributor to a bad outcome. But I think the perception that many people have is that these were very serious or very big comorbidities or pre-existing illnesses, and in many cases they were not. You're talking about pre-existing illnesses such as high blood pressure, asthma, diabetes, thyroid disorder, or things that were easily treated, that were manageable, and people that went to work day in and day out with these pre-existing comorbidities and did just fine. So I really would just encourage people that as they are thinking about the vaccine and whether or not they need them, that they would understand that whether or not they have a comorbidity, they may not even know they have a comorbidity. Yeah. There's so many people that have mild cardiac or heart trouble or mild hypertension and completely are unaware of it. And unfortunately, we've seen even within our own staff, people that had nothing that we were aware of that have really had some very poor outcomes with when they were exposed to the virus. So I would really encourage people to get the vaccination. The side effects from the disease itself are so much more devastating than those that we're aware of with the vaccinations. Some of them have been very devastating. Stroke-like disorders, kidney failure, lung damage, heart damage. Those are very, very life-changing side effects. And those are the things that the virus itself has had as a side effect. And so when we talk to our staff, that was a part of our conversation, is that, we do know some of the side effects from this virus, and they have been very bad. And with regard to the vaccine, most of those are easily managed. And so we hope that people will use the vaccines to help us push through this and get through it more quickly.
Definitely. Thank you for your additional insight. I appreciate it. Thank you for serving our community and being present, and, continue to protect yourselves and protect your family. We appreciate you.
You stay safe as well. Thank you.
Thank you.